Hi, welcome to another Better Health Together discussion. And I thought it's only timely that we talk about my health record. Many of you be aware of the level of press received in recent weeks, and the WA Primary Health Alliance has had a role working with general practice and pharmacy and allied health, but also the community in preparing their readiness for the utilisation of my health record. However, I think it's just important to focus on a couple of things. One is my health record is but one element of a broader digital health environment, and many of you would be aware of secure messaging, e-referrals and so forth, all of which are the building blocks of a digital system that ultimately seeks to improve not only patient safety in terms of the sharing of information, but reducing waste, so reducing the number of diagnostics or pathology tests. And ultimately, while my health record is a summary, an uploaded summary of a patient's care, it still provides information in the event of there's a new clinician or a person unfortunately has to attend an emergency department through an urgent matter or critical reason. So I guess there's more than it just being, and I don't mean it like that, the patient's record. Ultimately, sustainability of the healthcare system is as predominant in terms of the dialogue that we all talk about. And one of the elements is to reduce costs, reduce waste, wherever that's possible, yet at the same time improve outcomes for people. So my health record has a key role. I won't go into the data, but you can imagine the reduction in diagnostics if those records were available at point of sight by a clinician rather than them being reordered. Similarly, from a medication review perspective, if a person's discharged from hospital, the notion of their medications being able to be reviewed quickly. Importantly though, my health record from a consumer perspective does more than that. It enables the person to have their advanced care directive uploaded. It enables the person to put their own notes in about what their self-management process might have been, what discussions occurred, what to do next. And I have to say, as an older person with aged parents, from my perspective, it'd be an absolute bonus for me to actually understand what's going on around them with their healthcare. So in these last weeks, there's been lots of myths about what my health record does, what it doesn't do, and its safeguards. And at the end of the day, there are a range of myths, and I'd encourage you to go to our website, to Primary Health Exchange, and have a look at the myths and have a look at some of the Q&As that we've been collecting. And if you have a question, please leave that. But the choices are actually pretty simple. A person can do nothing, i.e. opt in, and the record will be there. They can opt out, or indeed they can opt in, but with conditions, with their own personal choice about the safeguards, about who can read what. And so there are choices for people to protect their information, whatever elements of their information they are seeking to protect. And clearly over time, as people gain more confidence, they use the record more, a person can go in and change those safeguards as they see fit. So remember, please go to Primary Health Exchange to have a look at the myths, and also please note any questions you'd like us to answer. Till next time, bye for now.